So
No.
hello.
Well, people are logging on. Are you able to screen share, Yama? Is that
Yeah,
feature working for you?
let me see. Yeah, there you go. All right.
So maybe just give it another minute or so, and then whenever you want to get started.
No worries.
Now, if you want to go ahead and get started, go ahead.
All right. Hey there, everyone. My name's Yama. I'm the Sleep Fellows. So today I am presenting my grand rounds, and it is based on biomarkers of sleep or markers of sleep. Just a little quick backstory on what brought me interest in this is so I'm interested in anything like that has to do with hair. So one day I decided to just search up how the correlation between hair and sleep. And so later on in the study we'll get more into it, but essentially what I kind of like delved into is how hair can be used, or part of hair can be used as a biomarker for sleep. So that's what got me interested in this topic today. So just a few things that are going to be discussed today is what exactly are biomarkers, where exactly are they needed in sleep, and what are we currently working with, and what's there to look forward in the future, and what's currently being researched on right now. So biomarkers, just go off with the definition. So biomarker is a biomolecule that is usually found in bodily fluids. So it could be blood, urine, saliva, and it's used to interpret whether a process in the body is considered normal, abnormal, elevated, underestimated, things like that. And so, in order to be considered biomarker, it has to be able to measure to be accurate, and it has to be reproducible. And so I just gave a little bit more of a definition with the World Health Organization that it's any substance or structure or process that can be used to measure in the body or its products that could influence or predict an incidence of an outcome or a disease. So that's the entire use behind why we get certain biomarkers, is for us to interpret like medical conditions, or if a person is undergoing treatment, how it can be used to interpret like the outcome of the treatment, mortality rates and whatnot. So they're used very widely throughout medicine. Okay. So one thing to keep in mind is that biomarkers are not always clinical endpoints. So a lot of times what we think about is that, if there's a particular biomarker, like for example, with RLS and ferritin, a lot of times we see ferritin, we say, okay, this is the ferritin, so we proceed with X or Y. But one thing I do want to bring up the fact that oftentimes biomarkers, especially in research, are not always clinical endpoints. Essentially, a lot of times what clinical endpoints actually are like things that, how patients feel, it's survival and overall function. But the nice thing about biomarkers and why they're often misinterpreted as clinical endpoints is because they're very objective and quantifiable of a disease process, and we can oftentimes use them to essentially manage our treatment. And overall, this is a very important point in research as well. So oftentimes biomarkers, specifically in research, are used as surrogate endpoints. So in other words, what that means, for example, if if a group of researchers are trying to figure out a process for a certain disease, they can often, if there's a specific biomarker that this disease produces, throughout its lifespan or towards the end of its lifespan, they can use that as a surrogate endpoint to kind of use that as like an anchoring point to revolve their treatment around, to revolve their research around, but it's only a surrogate endpoint. So the whole idea with a lot of times the actual endpoint, like I kind of mentioned, is survival or reoccurrence of disease. But biomarkers are very particularly useful as a surrogate or an anchoring point with research. And it's actually nice too, because technically, since a lot of biomarkers are brought up before this clinical endpoint of survival or mortality, it can be used to, like, I guess, expedite research in a way. Because if your biomarker shows up after 6 months and survival rate is 2 years, you can imagine having that 6 months versus 2 years. That's a huge advantage in regards to timeline. So it's able to provide like interim evidence for safety and efficacy as well for medications. And so oftentimes that's just something I just wanted to drive home, that it's not an endpoint, it's used oftentimes as a surrogate endpoint in research specifically. Um, so how exactly can biomarkers be used in sleep? Well, our bread and butter for obstructive sleep apnea. For obstructive sleep apnea, the way I always describe it to patients is that obstructive sleep apnea has its tentacles in a lot of different diseases, and it can affect a lot of different diseases. And treating obstructive sleep apnea can oftentimes improve certain disease process, whether it's RLS, insomnia, or even hypersomnolence. And so if we, based off of what I've read and, what I've been able to interpret is that if we do have biomarkers for obstructive sleep apnea, if, someone were to come up with that, it'd be a much better allocation of resources, because then we have a quantifiable, like, objective measurement of sleep apnea. We technically do have that with the AHI, but in regards to disease process within the body. And then, if you could use that as another surrogate endpoint to, to analyze, as well as to, add advocacy on certain treatment processes, that's also how a biomarker can be used. So for example, we use a secondary diagnosis oftentimes, whether it's hypertension, whether it's excessive daytime sleepiness. But as you can imagine, if, for example, this biomarker could be used as a secondary diagnosis, you can imagine how that could decrease delays in treatment, because then you don't have to see the patient. You don't have to have another appointment just to get more information, or even if it's like go through their charts to figure out if they have a secondary diagnosis. It could also be used as another way to interpret certain developmental prognostic tools. So again, we do use a machine estimated AHI, which is like a clinical marker for the like how well obstructive sleep apnea is being treated, but it is a machine estimated AHI that we use from like certain PAP devices. And so it's not the most accurate. And so adding another clinical biomarker could definitely interpret how you would move about with treatment, rather than just having just like machine estimate HI. For example, if you were to have, like, for example, biomarker that is more prevalent in central sleep apnea rather than obstructive sleep apnea, that would add to the clinical indication of whether or not you should probably get like another titration study. Do you want to add TCO2? Things like that. So it can better manage not just resources, but kind of guide clinical practice and add to your clinical suspicion as well. So for acute sleep deficiency, where this can be particularly useful is one thing, the fellows and I, we always mention to our patients, we always rehearse safety, to essentially not operate heavy machinery whenever drowsy. And so in acute sleep deficiency, this is where, someone doesn't have to have a diagnosis of narcolepsy to have acute sleep deficiency. And so, but if there were biomarkers available for acute sleep deficiency, you can imagine how that would help us in determining safety and efficacy, especially in like, a work environment and whatnot. But where else this can also be used is for shift work. There's a lot of patients there's definitely patients I've seen who have multiple shift works. They take up shifts. They'll do the midnight shift and do the morning shift, and this could help. One idea that I was just thinking about that this could help out with, if like theoretically, if a patient comes in saying, I work like 2, 3 extra shifts a week, you could ask for like a week's worth of, um like not a week's worth of saliva, but essentially like a collection of a week's worth of, a biomarker, and you can use it to interpret that when exactly are they like most acutely sleep deficient, when they should, which shift they should probably switch over. It's things like that. So we can, it can be used to determine safety and quality assurance. And it can also help differentiate from different like episodes of acute sleep deficiency. If a patient just had a rough night one night versus, is this all from like a shift work disorder? Is this all from something else? So it can definitely help us like estimate and kind of also reflect to the patient how much their acute sleep deficiency is actually uh intruding in their life. Biomarkers can also be, very helpful for chronic sleep deficiency, because it can help personalize treatments, especially in conjunction with other treatments. So we do definitely have patients that we come across where we don't just have them on one treatment or one medication. They're not just doing CBTI and that's it. But there's a lot of combination going on, especially if a patient has a goal, for example, of trying to wean off their sleep medications, and they're trying to develop habits in order to, make sure they stay off the medication, implement those like habits from, for example, from CBTI to make sure that they can sleep throughout the night without the use of medications. So there are patients that are very motivated to do that. And so, using a biomarker for chronic sleep deficiency can definitely help our clinical guidelines. Okay, for example, like you've been on this medication for this long, so that, and using biomarkers can kind of help guide that in a sense, especially can, if nothing else, it can also be used as like predictive outcome, given that, as you can imagine, if you were to have a biomarker that, increases with the chronic sleep deficiency, how hard it would be to taper off a certain medication. It would, kind of guide us on like advising the patient on how to taper off certain medications. Um, and then it can also help us like kind of tell us how much their chronic sleep deficiency, let's say, for example, if we don't know if they're short sleepers or, if they just feel tired all the time, we can, it can help us interpret how much their actual sleep is intruding in their other clinical diagnosis or any other or any other disease that they have. And so this is just like a table of what I just kind of spoke about. And also I will speak about circadian rhythm disruption as well, very momentarily. Um, so what do we have? As of now, for circadian rhythm, where we do have a biomarker is for these disorders, and where it's become particularly useful is not just circadian rhythm disorders, but it's also helped us like subdivide different circadian rhythm disorders. One question I ask my patients a lot, especially if they tell me they're very tired or they can't fall asleep, is I ask them, if they were given 2, 3 weeks off, they have absolutely no responsibilities. What time to what time do they believe they would naturally sleep? And what time would their, body tell them, hey, I want to go to sleep? And what time do they think they would naturally wake up? And a lot of times I do hear the answer that, or the answer they give is reflective off of the sleeping habits that they originally mentioned. So for example, if they, go to bed from 10 to 6, they'll report that they normally feel sleepy around 10. But sometimes you do come across patients who say like, oh, if I could choose, I'd fall asleep at 4 a.m., wake up at 12 p.m. And so biomarkers helped us like have given a lot of evidence for it, and also have guided our clinical practice in order to like really support the idea that, they have like, hey, they have a delayed circadian rhythm phase. And so because of that, either, we talk about changes in lifestyle, whether or not they need to, change shifts within their job, or how to go about with treatment for that. So DILMO, or dim light onset melatonin. So it was first developed around like 1989. And essentially it was measured in both the plasma and the saliva. And essentially, it's helped us like develop this like subdivision between the delayed sleep wake phase disorder, advanced, and a non 24-hour. One thing to keep in mind is that the saliva melatonin is about 30% of the concentration of melatonin, and it's not necessarily meant to be used to infer levels being produced by the pineal gland because it can often change throughout the day or throughout, a certain given amount of time. And then we have digital biomarkers. One that we use, both of them we use very, very often. So actigraphy, what is an actigraphy? So it's a wearable device, looks like a watch. We tell our patients to use this all the time. And then, it would be very fair to, tell our patients exactly why and how it works. So for those, I don't know how much catching up people have done, but essentially actigraphy use an accelerometer within the device itself to kind of measure movement, right? And with the interpretation of limb movements, it gives an estimate on wakefulness and sleep. And with that, along with the supplementation of sleep logs, we're able to infer a lot of different data, and I'll discuss that very briefly in the next slide. But total sleep time, wake after sleep onset, and sleep efficiency. And as you can imagine, this is very useful for patients who are undergoing an MSLT and being evaluated for a disorder of hypersomnia. And so I've also included in this picture today about, the different measurements that an actigraphy can assist with. So like WASO, total sleep time, sleep efficiency. And one thing to always keep in mind, they're not completely accurate. They're not 100%. Rarely things are, but they're fairly accurate. And rather, an actigraphy, the idea is what people have used in these apps whenever they come to us saying like, hey, I check my Fitbit, I check my Apple Watch, it tells me I'm getting this much of sleep. And I always give them the contingency that it's not like the perfect measurement. So to always take that with a grain of salt. But oftentimes what I do find is sometimes patients are motivated by it. So, if it helps them, then I have no problem with that. But I do give them that contingency. And it is used as supportive information for HSATs, MSLTs, and for periodic limb movements of sleep. All right, and then EEG, this is what we use all the time in sleep studies. It's one of the most common tools used in sleep research, and essentially the idea is that it tells us the different stages of sleep. And this is what I actually mentioned to patients, why a lot of times an in-lab sleep study is very important, is because using an EEG can help us differentiate the different stages of sleep and whether or not someone's actually asleep or not. Because we do have patients who have some form of paradoxical insomnia. So they'll talk about how they rarely ever sleep or they don't feel like you're sleeping, when in fact they're getting a lot of sleep, or a good amount of sleep, I should say. And this, if nothing else, this also kind of like helps support that idea. I've definitely had a few patients once I like go into the details of the sleep study, thanks to the EEG, I'm able to tell them like, hey, you told me that the night that you slept on the night of the PSG was about the same you sleep every night. And I just want to let you know that on this night specifically, you did sleep well enough. And so I kind of just go into, sometimes I go into a little bit of details about what paradoxical insomnia is. I mentioned to them that I'm not saying they have that, but it's an idea. And thankfully for the EEG, I'm able to give that description. So that further shows you how important like biomarkers or just markers in general could be of sleep. So what are we working with in the future? And so a couple things I will talk about is hair cortisol, microRNAs, and then saliva and how they have been used as well. So hair cortisol, just to go into a little bit of detail. So to touch up on from medical school, the hypothalamus pituitary adrenal axis. So the idea is that from the brain, there are signals to have certain hormones being secreted, and those hormones act upon different parts of the body, whether it's the thyroid, whether it's the adrenal gland. So specifically for cortisol, so ACTH is produced by the brain and it's sent over to the adrenal glands, and it is the zona fascicularis that produces cortisol. As you can imagine, certain diseases, whether it's pituitary apoplexy, whether it's a pituitary adenoma even, or if the adrenals aren't able to respond. So if it's like bilateral adrenal hemorrhage, from a disease or autoimmune process, you can imagine that cortisol levels would change a lot. But and cortisol has its effects in many different places. It affects blood glucose, it affects mental health. And now we're kind of figuring out if it affects sleep. Now with the study that I'm going to bring up in just a moment, essentially the idea is that they measured hair levels of cortisol in the hair, and it's actually a pretty good marker for very long-term cortisol levels. And as you can imagine, it is useful in the sense to determine or help support or supplement the idea that, this patient has been through a lot of stress and they're reporting deficiency in sleep. So there's some sort of objective data that's kind of supported with that. But the problem is that there's a lot of different things that can affect hair cortisol. For example, hair treatments. And the extent of that was not necessarily like spoken about in the study that I read upon, but it is something that they did mention, like hair treatments. I'm under the impression certain shampoos can affect this, so it's not something that can be taken with like, should be taken with a grain of salt or a couple handfuls of salt, but it is something that can be used as a biomarker to interpret sleep. And on top of that, technically with cortisol, because it can cause interruptions in sleep, and since it has its effect in mental health, you can imagine how cortisol can have like this insidious effect on sleep overall. So it's kind of like it feeds itself almost, so to speak. But the study that I did read did show that there were higher levels of hair cortisol associated with, the prevalence of certain sleep disorders. One interesting thing about the study I read was it spoke about Korean firefighters. And so it did mention how hair cortisol levels were higher in firefighters who had changes in their shifts, changes in the daytimes of their shifts, as opposed to those who had fixed day shift schedules. They had lower concentrations. And why exactly that was, that's not something they were able to determine. I mean, if I had to guess, maybe it's just the changes in the daytime, but essentially this can be used for shift work. So shift work did have, it seemed like a lower concentration of hair cortisol. And there are how, confounding factors that could have attributed to that. So that is just something to keep in mind. But overall, what I did want to just drive home is that hair cortisol could be used as a biomarker for sleep. It does have its utility. So hair cortisol in the pediatric population. This is a little bit different. Since the HPA axis is not as developed in the pediatric population, you can imagine that this would be a little bit more difficult to interpret. Especially in patients who were like 1 or 2 years old. But one thing that the study that I read did note was that in patients who were under the age of 1 year, who slept more than 10 hours were lower than those who slept under 10 hours. And the interesting thing is the study did report a positive correlation with increased hair cortisol levels along with major childhood events. And what major childhood events were, like, they weren't really described what that meant. If I had to give it a guess, it was probably stressful life events, whether it was, parents divorcing, a motor vehicle accident or something like that. That's my best guess. But I will say the details weren't necessarily given in the study. And then there was also an increase in morning cortisol, morning hair cortisol, with shorter sleep duration, as well as shorter amounts of slow wave sleep and longer amounts of light sleep. So microRNAs. What are microRNAs? So they're essentially small pieces of RNAs that regulate gene expression in a cell. They're usually used to degrade, upregulate different proteins, keep the biological function, processing, and adapting as well. It's not just to keep the same, but essentially what this contributes to is a development and I guess the degradation of as well as tissues and organ systems. You know, if there's an insult to the body, certain microRNAs are upregulated. If there's a stress to the body, there's certain microRNAs are upregulated. And so these expressions are essentially, the levels are determined on the type of stress and the level of the stress. So in our case, our stress can often be interpreted as sleep deprivation or just disturbances in sleep more generally. So the study that I read, what it did was that it used, there's a computational program called TargetScan. And so what TargetScan is, it's an AI system that essentially helps identify certain biological markers that are associated with certain microRNAs. And in the study that I read, there was about 59 total differential expressing RNAs that were identified that could have contributed to poor sleep. And two of them in particular were identified as possible biomarkers that were more so expressed in poor sleep quality. And the names are right there. The MRI 4433B. And you know, if you can imagine just for a second that these biomarkers are actually incredibly useful, because not only does it help with long-term processes, but it can help in very short-term acute processes as well. The utility would be a little more difficult, just as you can imagine, you know, if someone's going through like an acute stress with sleep, you know, that'd be kind of difficult to get them in, get some sort of like bioavailability to get these microRNA like levels. But for patients who come in and tell us that they have, you know, they have chronic sleep issues, they've had it for quote unquote years on end, this can be very, very useful. Because then you can kind of interpret the gene expression. You can kind of, you know, check the levels when those like when equipment for that becomes more and more available. But this can be a very useful marker for sleep deprivation and just poor quality sleep in general. And it can kind of, just like I was mentioning before, it can guide like treatment guidelines or, you know, treatment options that we have and clinical suspicion as well. So now non-invasive metabolites. So there was a study done in Japan, and the study in Japan essentially used salivary metabolites. And so they used approximately 8 in general, but the 3 ones they mostly focused on were glycerol, 2-hydroxybutyric acid, and hippuric acid. So one thing I just wanted to mention in this study, in order to measure sleep quality, the people who they recruited in Japan, they used the Pittsburgh Sleep Quality Index. This index was essentially, it's an index that asks you, you know, how well you sleep, how do you feel whenever you sleep. It's a very long, it's a pretty long questionnaire, probably like 2-3 pages, and it kind of gives us an indication on the quality of sleep that these patients have. And so what the study did was that it recruited coal mine workers. And so based off how they felt on the study, they were given a specific PSQI. And now on the day of collection, of like, you know, salivary collection, they use a different questionnaire called I can't even pronounce that, but it's an OSMA questionnaire, and this questionnaire is specifically used in Japan, or it's a questionnaire used in Japan, and this was utilized the night prior to the sample collection. This study didn't go into detail why exactly they used that particular questionnaire, but that's what they used. In regards to the metabolites used, so for glycerol, for example, it's in my next slide. Yeah. So with glycerol, and below is the questionnaire for the OSA-MQ that I mentioned previously. Now for glycerol specifically, is that they noticed that there was some sort of or there was a relationship that glycerol was about 19% lower in patients with like lower quality sleep, as well as with hippuric acid. So they were both lower in patients with poor quality sleep, and then salivary 2-hydroxybutyric acid were higher in patients with poor quality sleep. So as you can imagine, it's inverse relationship. And a lot of these different like metabolites had like an inverse or relationship with the levels that they were able to find in the saliva specifically. Let me go back really. Oh no, sorry, I meant to go back. Okay. One thing I did want to mention about which study was it? This study in particular as well, the microRNAs. So with the microRNAs, they also used, and when they were gathering the patients, they were using the PSQI index as well they're using the PSQI when they were asking for the sleep quality specific for the patients that they were recruiting. And so I've noticed that questionnaire was very common within like a lot of these studies I was reading about when it comes to getting into like the quality of sleep and the biomarkers they were kind of measuring. And yeah, that's what I was able to present today. Before I move on, one thing I would like to ask the fellows is that any is there any like biomarker that you guys thought of throughout the year when when you guys were seeing patients and whatnot that you think would be useful? Or it doesn't even have to be part of the study, what I mentioned, but overall.
Or put something in the chat. He said testosterone.
Oh, oh no, no worries. Okay, testosterone. Okay, no, that's actually good, especially when you take morning testosterone, especially if they're like sleep deprived. Sleep does have a somewhat of a correlation with testosterone. If you have like a week of what they considered poor sleep, that was not really like they didn't go into too much detail what poor sleep was, but apparently testosterone like goes down by almost half if you have like a week of poor sleep. Um, and if no other the fellows, are there any attendings that would like to mention about what biomarkers they found particularly useful or something they found interesting?
I think it's just a great talk. Thank you very much. I think the issue with biomarkers is just the clinical utility and like getting insurance companies to pay for it, or even like the practicality of it. Like even for melatonin, it's just not something that we can get or
Mhm.
easily get.
Yeah, I know it's especially in sleep, it's a little it's very difficult, especially to get FDA approval, especially if things are already working, since this field that we're working in is a lot of times very subjective. And so I do feel getting objective information would definitely help clinical guidelines, but you're right, getting like approval and whatnot is very difficult for especially from insurance. Are there any questions?
A comment, I
Mhm.
always thought of polysomnography, AGI, or whatever measure you have there, not so much as a biomarker, but as a measure of the disorder.
Mhm.
And then you might look for other biomarkers that predict the way that those measures that define the disorder. But I don't know if everybody thinks of that, seems of it that way, but I don't think every measure that we can take objectively is necessarily a biomarker.
Mhm.
But,
I kind of think of
Great.
biomarker.
Sorry, go ahead, Neeraj.
Yeah, Yama, I think I also think of biomarkers in the form of diagnostic and therapeutic utility. So those could be could be divergent in how do you assess their outcomes, whether diagnostic or therapeutic intervention perspective. But definitely there are some serum biomarkers that have been in the sleep pool that have been around. For example, tumor necrosis, alpha IL-6, C-reactive protein. So there are different biomarkers. But the one of the caveats that often is that these are inflammatory biomarkers. Depends on impacted, just like you said, with the hair loss and the cortisol biomarker, potentially those impact those two as well. But also the field, as some of them have circadian component too. So when do you test them? Is there a standardization of test to them early in the morning, in the afternoon, closer to bedtime? Similarly, with regarding melatonin, you're trying to tend to do it in the dim light time. So those are the things that the field will come up with an answer in our lifetimes, and hopefully that would be helpful. That's just my comments on that.
Thank you for that.
I think a good sleepiness biomarker is going to be helpful, hopefully one day. Especially to the extent we could predict not only what you measure on an MSLT, but maybe better predict motor vehicle accidents. Or
I was thinking about that too. Wasn't there some investigation in amylase as potentially being a biomarker of sleepiness? And does anybody know where that, if that's true, where that research is at?
we're sharing something about that too. In fact, a few years ago, there was a conference at the NIH, which unfortunately I wasn't at, but all about sleepiness biomarkers and the promise of them for the future. But I guess we're still in the future.
I think potentially blink rates have been looked into, whether blinking rate from a clinical background, pupillary dilatory changes with the drowsiness has been looked in by the auto manufacturer industry to kind of see whether they can make the driving safer. So those, I think, are another ways to look at it, not just from a testing perspective, but from observational perspective.
And I think now, some of the cars are just doing like, variability in driving, kind of as an indirect both of like distracted or drowsy driving. So like, lane variability, side to side, braking, etc.
Thank you, Shali. I think Todd started that many years ago. That's very.
Yeah, I mean, there's a lot of cars that have it, in other words, that's what I'm saying.
I should be collecting a royalty then. Yeah, no, I definitely did not start it. But Dave Dinges did do a lot of work on trying to identify appropriate predictive measures of drowsy driving. PerClose was percent eye closure was one that was on the market for some time. That was a little thing you wore that would be able to tell how much your eyelid closed, and that had some correlation with risky driving. So that's been a long-standing interest of many researchers.
Yeah, I don't know if you saw Farouz put something in the chat about hypoxic burden. If you want to speak to that a little bit.
Sorry. Not a biomarker, but yeah, sorry. So I guess using I definitely use the word biomarker a lot. But technically it's a marker in general for sleep is what essentially my talk was more so about. That's why I mentioned the actigraphy and the EEG. But yes, with the inflammatory marker, yeah, that's what Dr. Kaplish was also mentioning, how like TNF would be increased one up for like hypoxic burden rather than just AHI specifically. But yes, that is true. And then there's a few other comments. Isaac, CRP. I guess that both those would technically be more in the I guess so CRP I can imagine would be pretty difficult, because especially if the patient has a lot of different medical diagnoses, I can imagine how that'd be very difficult to measure. I mean, I guess you could use it while sleeping, but the problem would be how to measure that while sleeping. You'd have to get like, serial blood draws, and I can't imagine someone who's doing a sleep study would be okay with that, or would appreciate that. But I can imagine CRP might be higher, just because, if you have obstructive sleep apnea, then there's inflammation, especially around the throat, no? And then Dr. Vera, Oh, okay. Plasma choline levels were associated with sleepiness symptoms. Okay, you can take a look at that. Anyone want to mention any other comments, questions, or concerns?
I think the challenge, I guess, is that, you know, a lot of these markers are just not sensitive and specific enough.
Mm-hmm.
You know, there's too much variability to be used kind of in diagnostic circles.
Yeah, I was funny enough, I think it also not just not being able to use like sensitive enough, that is definitely true, especially like for example the hair cortisol. But I was actually listening to a talk about verteporfin. This is a little bit off topic, but I promise it'll make sense. Essentially it's an enzyme from fish that essentially can be used for like scar restoration or like hair restoration, especially after like a transplant for like burn patients, for example. And so someone mentioned, why is it not FDA approved? And the problem, just like any other thing in research, is that no one's willing to fund it, especially if it doesn't have a very promising outcome. So even if it does seem theoretically to have a promising outcome, the problem becomes that no one wants to fund it because it's almost like, yeah, I guess a way to think of it, it's almost like a bad investment or a very like a risky investment. So I can imagine with a lot of these things in sleep, since sleep is very subjective much of the time, to have like an objective measurement would almost be, it can only be seen like as a very risky gamble, because the question would become, how does it change management? So I can imagine a lot of these insurance companies aren't willing to invest in something that they don't foresee would actually help like better allocate resources. Also speaking, Farouz. So also speaking of management and biomarkers, throw back to biomarkers used to assess inflammatory changes with higher PAP pressures when using patients who have cardiac. Okay. No, very interesting. So Farouz over here was mentioning how biomarkers used to assess inflammatory changes with higher PAP pressures when using patients who have cardiovascular disease. Oh, that's then. I mean, yes, technically, then a biomarker could be used. No, oh yeah, Journal Club, yeah. Yeah, then a biomarker could definitely be used to help with management, but I think the research, especially for the funding of research, is needed for that. Is there anything else anyone would like to comment or anything? Oh, another. Let's see. Oh,
I think you raised some interesting conversations and thoughts about sleep measurement and sleep markers and kind of things to consider as the field continues to evolve and move forward. Thank you for presenting an interesting topic today.
no worries.
Great
Thank
job.
you so much for everybody that came by, and I hope you guys have a great rest of your day.
Yeah.